Thank you very much, Alexander, and for the kind introduction, and good morning to you, to everyone. My name is Annabel Seebohm. I'm the COSIA Secretary General, and I have the pleasure this morning to explain a bit the opportunities and challenges as regards the implementation of the European Health Data Space with my colleague Verena from MedTech Europe, and we're sharing a presentation to introduce our viewpoint on the challenges which were already nicely put out by our colleagues from the Joint Action, which I have to say were very nicely put. So COSIA, who's COSIA? Indeed, well, we are not a historic organization. Of course, we're a modern organization, but we were founded in 1959, and we are celebrating this year our 65th anniversary, no, last year, our 65th anniversary. And we are based in Brussels, and we're a European trade association representing the medical imaging, radiotherapy, health ICT, and electromedical industries. We are not for profit. We also have a desk in China, along with the European Chamber of Commerce in Beijing, and we're a founding partner of our global sister organization, DITA. And that, in a nutshell, is COSIA. We have, just to say, company members, such as, and some spoke here this morning already, for instance, Dedalus, but also active in IHE. On the vendor side, some company members who are active in COSIA, but also we have National Trade Association members. Now, what we did in terms of challenges, we provided, together with MedTech Europe, input to the ExpandEH project. And we did this basically around three key topics, and we raised problem statements, but also provided recommendations. And I will present to you the first key challenge, and Verena will then follow with the remaining two key challenges. The first key challenge, and you touched upon this already heavily, Juha, when you raised the questions, what is an EHR system? Well, that is not a trivial question, indeed. What is an EHR system? And you see it here on this picture, raises a lot of questions, because we have digital infrastructures for healthcare providers with super complex, interconnected infrastructures at national, at regional level, all sorts of levels. And, well, that is not a trivial question. What is an EHR system? As the answer may prompt different routes to take, be it MDR routes, so the Medical Device Regulation, which may be applicable, the AI Act routes, which may be applicable, and now also the EHDS Regulation route, if I may say it that way, because given the term as such encompasses not just the traditional, and you said that, not just the traditional EHR, electronic health record, but all sorts of innovative technologies, you cannot simply transfer everything because it may conflict with existing designs. And as industry, we need to know which effect these EHDS rules may have on our product portfolio, because it may also hamper product development. And of course, therefore, we need predictability. And how do we get this predictability? We think via product guidance documents, and you also addressed that, on mapping use cases with integration profiles to specific product types. And what we offer is expertise, experience, and advice. And without co-creation, and you mentioned this this morning as well, without co-creation, the European Health Data Space won't fly. And of course, that's all what we aim for, that the European Health Data Space, it's a pioneering initiative. We all aim for that this project will fly. So we really look forward to the upcoming consultations you mentioned, hoping that we may have more than 4 weeks to answer, but that we here really have a nice format in place where we can transparently provide input, but consultations which are not, let's say, last minute, but really nicely organized. And also looking forward to the additional governance interaction you mentioned. Maybe we can discuss this later in the panel, how this could look like. And now I would like to hand over to my colleague Verena, who will present to you the other two key challenges we addressed in our paper. So Verena, the floor is yours, please.